Welcome to Contagious Conversation, the #1 public health podcast, where we explore the most pressing topics in public health today. I'm your host, Erica, and I'm excited to have a fascinating discussion lined up for you. Today, we're diving into a topic that's gained global attention in recent years, mpox. Joining me is my classmate, Jessie Brown, who has been doing some incredible work on understanding and addressing mpox, especially in the context of public health and community awareness. Jessie, thank you so much for being here today. Can you tell us a little bit about yourself?
Erica, it is such a pleasure and a privilege to be on your show. From someone who is really interested in infectious disease, I am ecstatic to be invited onto Contagious Conversations, excuse me. I have been involved in medicine for about 14 years now. I was a paramedic on the ambulance and an ICU nurse for the last 14 years. So in that time, I've had the opportunity and the privilege to take care of some really incredible individuals and some historical events that took place, actually. Ebola when it came to Dallas-Fort Worth 10 years ago, and COVID when it was in my ICU. Just learning so much of the pathophysiology, the extreme disease components, and it's scary and at the same time absolutely fascinating, and you have to respect these viruses.
Can you start by giving us a quick overview of your project on mpox? What made you choose this topic?
So, like I said, mpox, formerly known as monkeypox, is of the same family as smallpox. The last case of smallpox was reported in 1978, and vaccinations ended in 1980. Mpox was first identified in 1958 amongst research monkeys, hence the name. In 1970, the first zoonotic case occurred. I am very interested in infectious disease, like I said, and this is certainly a unique one. Funny enough, mind you, funny to nerds that is, it was actually an ER season finale that talked about monkeypox. This was probably in the late 90s, early 2000s, and it was such a Hollywood hyped episode. Everything that could go wrong went wrong, but it's a really good episode. But, with monkeypox, mpox, we live in such a global world, and it is continuing to get smaller, which is both a wonderful thing with ambassadorial travel. I believe that empty pages in a passport are just waiting for that next country stamp. But the scary thing is also human communities continue to encroach on wildlands, and this is definitely causing an increased risk of zoonotic crossover disease spread. And so monkeypox, mpox is just one of many that is really taking the limelight right now.
That's really interesting. I need to watch that episode. Now, I remember you mentioning some major changes in the virus. Could you explain those for us?
Yeah, so for decades, mpox remained endemic to the region surrounding the DRC, otherwise known as the Democratic Republic of the Congo. So Burundi, Rwanda, Uganda, the Central African Republic, the Republic of Congo, all of these countries, they would occasionally see mpox from time to time amongst their citizens. And very rare was it ever serious. But in this current 2022-2023 variant, the Clade 2B variant evolved to be far more widespread, especially in the United States, where over 32,000 cases were reported and 58 deaths occurred.
Okay, so you've just described some critical aspects of the virus, but public perception plays a huge role too. How do you think stigma has impacted efforts to control mpox, particularly the misconceptions about it being a quote-unquote homosexual disease?
Yeah, Erica, that's a great question. I really believe that there's been a resurgence of the HIV/AIDS stigma scare of the 1980s and 90s, the treatment of them, barely delivering compassionate care to individuals with mpox just because of fear and misinformation of contracting the disease, even while these nurses and doctors are wearing the appropriate PPE. This stigma lessens the outreach and can cloud clinical judgment. I don't know if you know this, but of this homosexual disease, 83 pediatric cases have occurred. I don't think that was anything homosexual. It really is a shame that this disease of what was originally thought of as a homosexual disease, just because it is currently affecting more of the community of men who have sex with men, community spreads, period. And it doesn't matter who or where you are, close contact is close contact, and it does not have to be sexual. And so that's certainly where the 83 pediatric cases occurred.
We have been speaking about the misconceptions, how they can have a real impact on how the public responds to an outbreak. What are some of the biggest myths you'd like to debunk about mpox?
I would definitely like to say, for starters, it's not a gay disease. Yes, the distribution currently is highest among men who have sex with men, but that is what it is right now in the Western world. In Africa, that is not the story. It is definitely, there are more children being unfortunate victims of this virus. And so I would definitely, that's one of the biggest misconceptions right there. The other one I would say is you don't have to have the traditional mpox lesions visible to spread the virus. Typically, these lesions start anywhere from 1 to 21 days after exposure and can last up to a month.
Given the misconceptions, it's crucial for people to know how they can stay safe. What do you think the community should know and do today to stay informed?
I would say that for communities to stay safe, awareness is often the biggest outreach tool for both patient and provider alike. Although anyone can contract mpox, those individuals with multiple sex partners seems to be at a higher rate of contracting the disease currently. So I would definitely encourage a greater self-awareness of those individuals who are participating in more relaxed approach to sex. You are going to a dance club, or you're going to an area where sex is going to be more likely. If you have any sense that you are not feeling well, maybe don't go this time. And although mpox can definitely be spread through close physical contact, and it doesn't have to be semen, I would definitely still encourage condom use, just because condoms still save lives with every other STI, STD out there. And mpox is not an STD, STI, but it can be spread through the semen and penis interaction. And many of the men who have had sex with men, they have had lesions on their penises, throat, and their anus from interactions that they've experienced. So I would definitely just encourage a greater self-awareness and condom use.
So community outreach is a key part of this effort. You mentioned targeting specific spaces like gay bars and LGBTQ areas. How do you plan to engage these communities to better understand their views on mpox?
Yeah, so, it's certainly not a requirement to be gay, to go to gay bars or to go to, gay discos. But being a member of the gay community, I believe it definitely does help me have a better access into some of these unique communities, gathering spots. But I've also been in medicine, like I said, for 14 years as a paramedic and an ICU nurse. So it definitely gives me a little bit more credibility. Mm-hmm. And now, for the last year, I've been an infection prevention and control coordinator at one of our large DFW hospitals. I've seen and I've worked with Ebola. I've seen and I've worked with COVID. I've seen and I've worked with mpox. So I have that hands-on experience. And I am passionate about care and prevention. And I really hope that approach helps the men at the gay bar or the men at the, bathhouses or whatever else you may be trying to go and recruit surveys on. It helps make your audience be a little bit more approachable.
For your research, when you are gathering this data, what are you hoping to learn, and how do you think it will shape educational strategies?
So I would definitely say that continuing to assess baseline knowledge of mpox virus, what type of sexual practices, were drugs involved, just trying to assess truly what is going on, that why is it that the population of men who have sex with men in this country is at the higher demographic than what is being seen globally. I would definitely want to just have a little bit more of an inquiry to the how, the why, just because there's still a lot of unknowns that are there. And also trying to understand a little bit more of if sex is the predominant outlet, at least in this country, why then is, for instance, Harry Hines in Dallas is, historically known for women to be meet suitors to participate in sex. Mm-hmm. But why is it then that community is not having these same numbers? And that I'm definitely interested in expanding the survey to that community as well.
Yeah, that would be really interesting.
Yeah.
I want to speak now about prevention. So we earlier spoke about vaccines, and I wanted to ask about getting vaccines to the right people and how it can be complicated. What challenges have you seen in distributing the mpox vaccine to those who need it most?
Yeah, I think that's a great question. So one thing about the mpox vaccine that is wonderful is it is actually based off of the smallpox vaccine. And so the mpox vaccine is called Jynneos, which was made in 2019. And so the Jynneos, it's made from a weakened live virus, and it cannot cause smallpox, monkeypox, or any other infectious disease, but it does have a long history of efficacy. And so, as you definitely know on this podcast show, the smallpox vaccine foundationally is one of the oldest of historical vaccination. Initially started by English doctor Edward Jenner in 1796, where the doctor would literally take a scalpel, lance the pox, and then lance another person and do a small cut on them and spread that pox onto them. So, the smallpox spread and vaccine that we did in the early, from what our parents and grandparents would have experienced, that stopped in 1980. But the Jynneos vaccine arose from that vaccine. And so it's definitely much safer and easier. But the problem then is that smallpox, thankfully, is eradicated, at least as of now. And mpox was so endemic and so rare. And unfortunately, it only existed in Africa, where there was just not the attention that it warranted. And so that there just was not a large enough supply of this vaccine readily available. So in the beginning of 2022 and 2023, the public health departments and the government decided that it was best to target those individuals who were at highest risk. So that would, of course, be men who have sex with men, multiple sexual partners, have had previous STDs, STIs, participate in illicit drug use. So because of a vaccine that is so limited, they really had to make sure that that limited supply was getting out to where and who it was needed to best. But then, as I mentioned, it's not being delivered in Africa like it should be. And I think that is definitely one of the global catastrophes of what's going on right now. Whether it's on HIV, AIDS, or tuberculosis, or, dengue, and all of these diseases that are experienced globally. But in this country, we tend to do a better job of prevention and treatment. But then, unfortunately, globally, that same type of distribution is not happening in what's sometimes known as the global south. These countries that are not industrialized like the United States is. And I think that is definitely still a major problem with the monkeypox vaccine.
So you're also looking at mpox from multiple angles, including healthcare providers and policymakers. Have you noticed any striking differences in their understanding of the virus?
So, thankfully there has been a lot of conversation to address stigma and inform the community in a culturally competent manner. However, the future of mpox, and quite frankly, healthcare in general, really remains uncertain with the recent presidential election where former President Donald Trump was reelected. It's important to note his presidency that's going to begin in January in just 2 months. Obviously, we don't know the type of presidency he's going to run.
Right.
But we can go by what he did in his first term. And in his first term, he did disband the pandemic response team, in an attempt to streamline global health and security and biodefense. But he did fire many experts in that very valuable specialty. And I think it's important to also note that, yes, Barack Obama did expand on the pandemic response team, but it was started by George Bush. This is a non-partisan approach to care and seeing the world as a global community. And I think that that's definitely what gives me some pause from our future president, because of his actions during COVID-19 and just so much of the rhetoric that is being spread. I think it is definitely potentially a great unknown, especially with, there's been talk of RFK, Robert F. Kennedy joining the presidency of Mr. Trump, and there's just been so much talk about vaccine hesitancy and misinformation and, revamping of autism. So I truly don't know what's going to happen with healthcare and the approach and care of mpox or the next virus or bacteria that's going to be coming our way.
Yeah.
It really is an unknown time.
All right, Jesse, so to wrap up, if there's one takeaway you'd like our listeners to remember or an action you'd encourage them to take after hearing this conversation, what would it be?
I think what's important to remember is it's not a question of if, but of when. The original monkeypox spread from African rodents that was shipped to a distributor in Texas in 2003, and 100 zoonotic cases occurred. But in July of 2021, mpox returned to the United States. And this time, it occurred in Dallas from a man returning from Nigeria. It was that variant of the 2022-2023 strand. And then, of course, Ebola came to Dallas in 2014. So already in our small neck of the woods, we've had monkeypox twice. The African rodent zoonotic spread, and then the evolution from when this zoonotic disease spread person to person. And then, of course, and that was in 2003, and then 2014 with Ebola, and 2021, and then, of course, the strand that we're, experiencing now. DFW is a massive epicenter of travel and entertainment and education, and corporate companies all have their bases here. It really is a beautiful opportunity to embrace so many different cultures, but through that, I think it is important to be globally aware yet not afraid. But we need to know what's going on out there. And as the changing climate continues, another thing that is controversial apparently under the incoming administration, so too will the likelihood of expanding infectious diseases under a warming climate and decrease in wild spaces. So I think what I would really emphasize is it's not a question of if, but when. And if you see the world like that, we can do a much better job of being proactive instead of being reactive.
All right, Jesse, thank you so much for sharing your insights and important work with us today. We're grateful to have learned from your expertise. For our listeners, stay tuned for more engaging conversations on Contagious Conversations. Until next time, take care and stay informed.
Thank you so much.